Philip, thanks very much. And that was indeed a very enlightening series of presentations. Just to inform everybody, we are at one point, we're certainly at 130 participants. And most have remained on board, so that's a very good turnout, and we're happy, and I hope you're enjoying it. Please note the links that are on the chat, and there's a few that have been sent by my colleague Charles with some information on IFPMA positions and on falsified, including our position on the ratification, the importance of the ratification of the African Medicines Agency. But now I'd like to hand over to my colleague Bada for the third and final session, which is awareness creation and community responsibility. Thank you very much. Over to you, Bada.
Thank you, Greg. Good day to our panelists and participants. I am Bada Parasi, Chief Operating Officer of the Innovative Pharmaceutical Association of South Africa. Next to me, in a virtual sense, of course, is my co-moderator, Ms. Anika Don. Now, we have heard extensive accounts on the perils of falsified medicines to populations globally and across our African continent. A study released over 10 years ago revealed that fake tuberculosis and malaria medicines alone kill an estimated 700,000 people globally each year. Now, this may have been 10 years ago, but there's no indication that the situation is any better today. We have heard in the previous sessions how policy and legislation are applied to fight this scourge. We have also had accounts of the measures put in place by regulatory authorities in different countries, and now members of the pharmaceutical industry have put in efforts to help fight this serious problem. But how do we create awareness among members of our communities? How do we ensure that the policymakers, regulatory authorities, and enforcers of the law create an enabling environment for members of the community to report their experiences with falsified medicines? We have a great lineup of speakers who will share with us their experiences. And without further ado, I shall call upon two speakers who will tell us about the role of the Fight the Fakes youth chapter in increasing awareness in Africa. Ms. Hoda Kanso and Ms. Sophia Khan from the University College of London. The floor is yours, please.
Thank you, Mr. Bada, for that introduction. It's an honor to be here. My name is Huda. I'm a student lead at the UCL Fight the Fakes. I'm completing my final year of Masters in Pharmacy at UCL, specializing in technologies that detect substandard and falsified medicines in low and middle income countries. Young people of today are the leaders of tomorrow. Everyone should have a seat at the table. These phrases are often heard at high-level global health panels and events. However, rhetoric alone does not lead to change. Commitments and action must follow. Many young professionals will soon be the frontline healthcare workers and global health advocates who play a vital role in tackling health-related challenges worldwide, such as substandard and falsified medicines. Their early interaction with health systems and policymaking will enable them to address the needs of their communities. This is especially important with the ongoing global shortage of healthcare workers and strain on national and international healthcare systems. Meaningful youth engagement and power sharing requires resources and normalization of the presence of young people at every table, not as tokens and decorations, but as equal partners and experts on global health. Space should be made for youth to take seats on high-level committees, advisory boards, and decision-making bodies. Meaningful youth engagement is an inclusive and mutually respectful partnership between youth and adults, whereby power is shared and young people's perspectives, skills, and strengths are integrated into the delivery of healthcare strategies, policies, and programs that affect their lives, communities, and their world. The Fight the Fakes youth chapters acknowledges youth as the driving force behind advancements in global health and puts them at the forefront of raising public awareness about the dangers of substandard and falsified medicines. Providing youth with opportunities for development in global health organizations creates a ripple effect of positive outcomes with benefits for young people, adults, organizations, and communities. The youth's ability to cut through the status quo and hold leaders accountable makes them the most vocal advocates on global health issues, such as falsified medicines. We cannot dismiss their unparalleled fluency in social media and digital technology, making this generation the most influential in bringing about positive change in their local, regional, and international communities. While we applaud progress, more must be done to position young people as equal stakeholders in tackling substandard and falsified medicines. Youth are not waiting until tomorrow, but are leading now and catalyzing change in their communities. Thank you, and I'll now pass on to Sophia.
Thank you for that, Huda. I'm Sophia. I'm also the co-student lead of UCL Fight the Fakes. So Fight the Fakes is an inclusive multi-stakeholder association, including partners representing the entire supply chain, raising awareness about the dangers and the impacts of fake medicines with the goal of uniting voices of individuals and international organizations against fake medicines. Fight the Fakes started as a grassroots advocacy group and is now a go-to place for sharing information and opportunities for action whilst growing allies globally. So UCL is the first higher education institution to partner with Fight the Fakes, and we here are committed to the goal of increasing access to safe medicines by raising awareness on the dangers of substandard and falsified medicines with the aim of prioritizing fake medicines on the global agenda through education, research, advocacy, and policy change. Our academic staff and our students have been working over to expand the campaign by capacity building, by developing pilot pharmacy curricula with 5 African universities in partnership with the WHO, partnering with tech companies for student research project using innovative devices to detect SF meds. We've also been putting a face to fake medicines by sharing the real stories of the true victims and those who are impacted and those who are fighting against them. We also share resources and news and updates for organizations and individuals who are looking to support the anti-counterfeiting efforts. We amplify partner activities by focusing on patients, including IAPO. And we outline opportunities for action to drive a manifesto to increase action at a local and global level. So UCL Fight the Fakes have been extremely active during the pandemic when the threat of SF meds has risen. We felt it was important that we use our digital platforms to serve as information hubs about fake COVID-19 medicines. So the UCL Fight the Fakes team worked from home to create an online video series which aimed to provide accurate and reliable information regarding coronavirus symptoms and advice, and also to alert the public about the circulation of unapproved falsified COVID cures, fake tests, PPE, whilst sharing tips on how to buy medicines online safely. We also hosted a series of Instagram live events in collaboration with the International Pharmaceutical Federation and UCL Global Citizen Program to raise awareness about the rise in the illicit online and offline sale of medicinal products during the pandemic and kind of the vital strategies to keep consumers and patients safe. In another live event, we gave a voice to a victim who was personally affected by the issue. So the event featured Nelly Maguru, a young Kenyan student who unknowingly took falsified painkillers, and her story led her to join our movement, and she is now the student lead of the Fight the Fakes Kenyan chapter. Our students were also involved in a mini-series for the 75th anniversary of the United Nations titled A World Free of Substandard and Falsified Medicines with 12 of our global partners. The series reached over 20,000 people and had over 750 engagements. And our team members spoke about the widespread infodemic and the rise of fraudulent COVID medical products and PPE, and how UCL Fight the Fakes is contributing to this global fight. Most recently, UCL Fight the Fakes joined the online platform TikTok, where we gained over 160,000 views on our videos, which aim to raise awareness about this rise in fake medicines, tackle the myths surrounding the unapproved treatments, and help to combat the infodemic. Fight the Fakes also held a side event at this year's World Health Assembly, where our co-student lead Huda delivered a powerful call to action, bringing together the voices of all the Fight the Fakes academic and youth groups, whilst demonstrating support for the WHO leadership against falsified medicines. So from us here at UCL Fight the Fakes, I thank you for your attention.
Thank you so much, Sophia and Huda. Clearly, getting the youth to be involved at a very early age has to be one of the most effective ways of ensuring that awareness is built among all sectors of society. I'd now like to call upon my co-moderator, Anik, to take over. Thanks, Anik.
Thanks, Bata. Thank you for giving me the floor. Good morning, good afternoon, everyone. I am Anik Adonkwaku from LIPA. LIPA is a pharmaceutical association in French sub-Saharan Africa countries, and I am the anti-counterfeiting director and based in Ivory Coast. It is a great pleasure for me to attend this session and to introduce Mr. Kawaldip Semi from IAPO, the International Alliance of Patient Organizations. Kawaldip oversees the strategy and direction of IAPO, and he has an extensive public health experience at national and international level. Today, he is going to talk to us about patient organizations' role in combating falsified medicine. So please join me in welcoming Mr. Kawaldip.
Thank you very much, Shadan, and all the moderators, and you have done a great work since morning, and all those who have participated. Just to fill in your background why this subject matter is important to me, I'm African through and through from Kenya, although living in London at the moment. And I have seen the devastating effect this issue of falsified, substandard, and fake drugs has had upon the continent, from personally, from my families and to friends, and even within the schools. I know from colleagues of mine, when I was in primary school, children dying because they had falsified drugs, plus others. So the subject matter is important to me. And I believe very firmly that there should be nothing about us without us, meaning if there's something about patients, if there's a law about patients and patients' welfare, then the patients must be part and parcel of that lawmaking and law enforcement. More importantly, enforcement. We have a tradition in Africa, sorry to say it in this fashion, that we have a kind of a propensity to make brilliant laws, main laws, and then put them on the statute books where they gather dust. We cannot have a good framework and regime of de jure and de facto law implementation unless we have got that enforcement there. So I firmly believe that within this whole matrix, the patients should be empowered, and as with citizen journalists in other parts and consumers in other parts who have been mobilized with mobile phone, other activities, and you're very fully aware how Kenya has advanced itself in some of the software design, especially during the, when we have civil unrest, there were apps there that could point out where the unrest was going on, and then authorities could quell and take charge of that. In similar fashion, we do need some apps like those to give to citizens who can go to each and every pharmacy where they take their medicines, and the patient can easily pick up the QR code or whatever it is and notify any of these falsified. I've seen in the Indian situation, there was a very good activity taken over where patients were actually engaged in going jointly with the enforcement and local authorities to each pharmacy to work out how many of them had that falsified drugs in their possession. And it cleared out many of the things. I think we were really good. So my opinion right now is that, one, we do need the African Medicines Agency Treaty ratified, within which we must have patients' engagement and enforcement formalized. In other words, patients are not passive. This hurts me. I take my drug, I need to know it's safe and it is of quality and that is going to do what it's going to do, and it says what it says on the tin. And therefore, I do not have to depend upon a third party to help my safety. So I need to be personally active. So I would advise all African patients to be into action. For the pharma industry in Africa, I think you have a lot of hard work to do to include patients in your activities, and please do that now. Now is the time. As you saw today, this morning, in the FDA, BioNTech and Europe was saying, oh, we will start manufacturing the mRNA vaccine in Africa. The question then immediately raises where, where is a good manufacturing practice and who? We need to be in charge of these issues. We can't be just passive recipients of medicines. And lastly, I think which you cannot stay away from, we do need patient engagement in looking at corruption and the racketeering. Many of these drugs are not coming through or being smuggled in, actually. They're coming in open view of some of our port authorities, airport authorities, and sometimes under the political patronage of some very shady legislators and others. And therefore, we must look at this as well, make sure we've got Interpol here, presumably looking at this. We must look at this whole trade in that respect, that the citizen needs to be back in charge. We cannot sit in the background. And as a patient, cancer patient, colorectal cancer patient, I know how important this is for my fellow patients in Africa and elsewhere, that we have already got a lot on our plate to deal with the condition concerned. We don't want an additional hassle of a fake drug put into the system. So therefore, please join us and ask for the ratification of the African Medicines Agency Treaty so we have one common regime. Thank you for your time, and bless you all, and take care.
Thank you very much, Mr. Kawaldip, for your presentation. And as we understood, we need to protect patients, and with patient engagement, we need to work in preventing and combating all falsified vaccines. So I would like to give the floor to Bada for the next discussion.
Thank you, Anik. So we've heard the role that's played by the youth and that should be played by the youth in the scourge, in combating the scourge. We've heard from Mr. Kawaldip what role is played by patient organizations. And now let's move over to the role of the healthcare provider. And for this, I would like to hand over to Dr. Titus Biu, who is the General Secretary of the Ghana Medical Association. Doc, over to you, please.
So thank you for the opportunity. Sorry once again for the delay. I don't know if I have permission to share my slide. I just have a brief presentation for all of us, and then I should be done.
Please go ahead with your slide.
Okay, thank you. All right, so my name is Dr. Beyo, as mentioned, and once again, apologies for the technical hitch. I just want to share briefly some of the challenges and frustrations we face as healthcare providers. I represent the Ghana Medical Association, the Association of Doctors in Ghana. I am also an obstetrician gynecologist and a lecturer with the University of Ghana Medical School. And as this is a meeting of regulators, industry players, I just want to share a brief perspective of what goes through the mind of healthcare providers when we talk about falsified medicines. The basic questions that come to us will be, why at all would anyone manufacture a fake medicine? Is it only for financial gain? We know that the industry is worth billions of dollars, but is that worth a human life? But for those who are perpetuating, do not have answers. The next question we want to answer is, how can I tell if the next drug I'm about to administer is fake? Then if you have a therapeutic failure, we want to find out, is it as a result of falsified medicine or a genuine therapeutic failure that we have to look at? And then a trusted source. As I sit in my consulting room or in the theater and order a medication, can I just tell from the source or the manufacturer if this is genuine? With procurement systems out of our hands, how do we tell that what we are handling is genuine? So I'll share one story from the field of obstetrics and gynecology, which is where I practice. And that's the story of fake oxytocin in Ghana. Somewhere in 2013, the FDA of Ghana reported that 90% of oxytocin use were substandard. And then I captured this one from the Daily Graphic of Ghana, a newspaper publication that says the FDA has apprehended and seized several medications from 3 companies, and they go ahead to list the companies that imported these fake medicines. While this may be money and regulatory issues for people, from the point of view of the practitioner, what did we see? During the heat of this in 2013, 2012, I was in my later part of my residency training as an obstetrician. And I can recount a few times where you would have a woman with postpartum hemorrhage, the uterus is not contracting, and then our first line is to secure a line, run some fluid, and then give oxytocin. We have second line drugs that will come in like ergometrin and carbetocin, if the patient's clinical condition will permit that. But the first line is usually oxytocin. When we are hot this way, we give the oxytocin according to our protocols that we know, and then the uterus will simply not contract. Then what we're wondering is it just a genuine failure that some uteri will simply not contract because they are tired because of some physiological condition? But little did we know that the medication we're using were fake or substandard. And the next line of action when the uterus fails to contract on medication is surgery. We go in and do various surgical interventions, applying sutures to get it to contract. And when it fails, we have to take out that uterus to prevent the woman from dying. And I can mention a few women who lost their uterus just because of this. On later than this news item comes up that a lot of the medications were fake. And when we're getting very young women not responding, we started making complaints to the FDA. And then investigations began, and then lo and behold, over 90% of those on the market were found to be fake or substandard. In another hospital, it was reported that fake oxytocin kills a chartered accountant in a maternity ward. And this was attributed to the head of our Christian Health Association in the country. So whilst for us, we were doing interventions like taking out people's uterus, which makes them infertile for the rest of their lives, in other parts of the country, people actually lost their lives simply because of this fake medicine. And sometimes it takes a while for us to be able to tell that this is fake, because we are not trained to identify from the packaging. And sometimes when the medicine fails, you want to be sure that it's actually the medicine that is failing, but not that the clinical condition you are dealing with. So that time lag from the point where we suspect that they have an issue, so when the FDA actually proves that this drug is fake, you can imagine how many needless lives can be lost and how many people would have had significant morbidity. So with this in the background, I'll tell another story before I just wrap up. I am into fertility treatment. Recently, we took somebody, IVF, in vitro fertilization is not cheap in Ghana. and I guess in most African countries. We were using some form of beta HCG for what we call a trigger. When we give some of our fertility hormones, towards the end, we use beta HCG to cause what we call a trigger to occur. We gave this and we're not getting any response. And we said, no, if this is beta HCG, then a urine pregnancy test should, a pregnancy test with a beta HCG with a dipstick should be positive. We tested it and there was no sign. This is supposed to be 10,000 international units of HCG. And there it was nothing. So we started a process of reporting this to the FDA for them to investigate and then come out with what this will be. So these are some of the experiences that we meet. But the most important thing for us is there's always a lag from when we suspect to when there is actually a confirmation, when the FDA is done with its investigation. And that lag period, a lot could go wrong. I should talk about the way forward by saying that the swift action of our FDA inspires a lot of confidence in providers in Ghana. We have absolute confidence in the FDA of Ghana because they do a very good job. They give us timely reports when they finish their investigation, and we see the swift actions of seizures and prosecutions. And therefore, when a drug is certified by the FDA, we have a lot of confidence. But they are challenged from their earlier patient. Market surveillance, they may not be able to do as much as they want to, and capacity building. So that still gives room for things to filter through. Then the other thing is that doubt exists among practitioners on the hospital procurement systems. Because if these fake medicines found their way, or some medicines found their way through our central medical stores and were distributed to the main hospitals, then you are worried when you pick up a drug from there. If they were bought from the OP market, then you could blame the hospital management. But if it comes to the central distribution system, then we are worried. We are not sure what has been done to rectify this. And so we still have some doubt in our mind with the procurement loopholes. Then we think a real-time identification system backed by a solid IT infrastructure will be the way to go, such as the use of QR codes and mobile apps. A mobile app was invented in Ghana here that you can send a text message to be able to tell if a drug is fake. This is helpful. The FDA is trying to digitize its processes of reporting. This is helpful, but this must be made more user-friendly so that in a theater, if I just took up a drug and I think this is not correct or have any suspicions, there should be a code that I can just scan with my mobile phone and be able to tell this is from a genuine source or this is from a genuine source. Then I can start the processes of filling the FDA requirement forms so that they can, pharmacovigilance forms, so that they can investigate this. The decision process must be brought down to the lowest level that everybody can use, and it should be very, very user-friendly. In that way, it will be easier for us to report. So the role we can play as practitioners in the midst of this frustration is when we have suspicion to report timeously. That process should be made easy for us. And we will plead with the regulators to also do swift investigations so that the report comes in earlier, so the lag period is minimized. So I'm grateful for the opportunity to share a few of our experiences. We appreciate the efforts of all regulators and manufacturers in the fight of this menace and this conference that has been put together to work on this, because indeed, significant morbidities and mortalities are happening because of falsified and fake medicines. Thank you.
Thank you, Dr. Abiyu. Your presentation was so important and forceful. I just couldn't find it in my heart to say, please, we've run out of time. But what I'm going to do is I am not going to ask any questions because of the lack of time. And I'm acutely aware that some of the panelists participating on the next panel session have to rush to another meeting that's starting in less than 5 minutes. The one question that I would like people to think about is as follows. We've heard accounts of how fake medicines get into our countries, across our borders, and so on. And for me, the question arises, what are we doing to counter this problem at the source? So I'll leave you with that and give over to Greg for the next session. Thank you.